Can't move those feet. Oh, ow. Extreme baseball blunders, the ultimate bikini, and milk doesn't do a body good. In honor of the new film coming out, today we are breaking down and reacting to all of the wild, over-the-top medical scenes and cringe-worthy injuries from Jackass. Let's dive right in.
I'm Zach, and it's time to play ball.
What? Oh no. Oh, that could hurt a lot. Right shoulder into the chest. It is dangerous. You probably heard where athletes get hit in the chest and then they go into cardiac arrest. That amount of force hits on a certain part of the beat of the heart and actually sends it into an abnormal rhythm. Hitting with that shoulder, you can cause a shoulder dislocation or fracture of the humerus or shoulder in and of itself.
Way to watch it.
Oh, that slip and slide. I really hope this is lubricated well. You get some really bad skin burns to this area where if it's not a smooth surface, you're gonna start burning away the top layers of your skin. You just treat it like an open wound. It's going to ooze a lot. Oh, a tennis ball machine. That jock strap most likely has a cup in there, but it's still compressing the gonads. It's gonna cause a lot of pain. Maybe not some bruising, but it will hurt. Ow. Lower pelvis and upper thighs. But what hurts him the most is actually the one that hits him in the chest. Gotta be careful. Ribs are a lot smaller. They can break a lot easier. He's got hit right on the lateral side of the sternum, which has your cartilage there, which then can actually cause some inflammation and something called costochondritis, which is inflammation of those rib heads.
Dude, that's bad.
I hope that they hit it like perfectly. If it goes to the side, you can hit your iliac crest, which can fracture a bone because it's exposed, soft tissue swelling. We'll see people who come into the emergency department with testicular traumas. Usually there's some swelling to the area, scrotal edema or ecchymosis or bruising. We will definitely get an ultrasound in those scenarios.
It's time to find out if music calms the wild beast.
Oh,
I'm Ryan Dunn, and this is the Ram Jam.
Yeah, I don't think it's gonna calm. Brass instruments are quite loud. Oh, with the Ram, thank goodness, less likely that they're going to have a penetrating trauma. But repeated injuries and trauma to your soft tissue, you can get bruising, hematomas. But what ends up happening is you can also get muscle breakdown, you can get ischemia to that tissue. It could take a long time to recover. Oh! If that ram also hits on the lateral aspect of the knee, you can actually cause a disruption of your ACL, your MCL, and your medial meniscus. Could cause significant trauma to your knee. We see that in like football injuries called the terrible triad, coming from a lateral aspect going medially.
I played like maybe 2 weeks ago.
All right, sir. This is such a bad idea. I am a pretty good golfer. I got a handicap all the way down to a 4. I would not trust myself to swing hard to hit this off of an individual. I would not want to cause significant trauma or injury. Oh!
Oh my God! He hit it after it fell out. Dude, I saw the ball like an inch away from my face.
Yeah, I don't know how he hit it when it was falling. That was
wow.
Wow, he moved. Don't move. If he took a divot where you hit under the ball, you could actually have a high chance of losing your testicles. Maybe it would go sideways, not have your legs open. So if it hit, likelihood would like bounce off your hip.
The corner to my left.
Still boxing.
Stripes. Steve. Oh! Wearing the red trunks. Ryan, I'm almost done.
And I do have to worry about falling because you're actually up a great height. We talk about trauma activations. If you fall greater than 3 times your own height, these gentlemen are probably 2 times their own height. And when you end up falling from this high, you try to put your arms out and brace your fall, which increases the risk of a foosh. Can't move those feet. Oh, ow. It's good that they actually are wearing headgear and gloves. If I was on scene helping them, trying to protect them, I'd probably put something on around their hips and their waist in case they fell. And once your body starts moving, oh my gosh. Oh, Brings up a good point that elderly patients are at risk for hip fractures. And they actually have these devices that almost look like fanny packs that have accelerometers in them, and then they pop out like an airbag to protect you in case you do fall to help prevent a hip fracture. The bikini. Oh, geez.
Bees?
They probably have some pheromones or something on the bikini. A friend of mine, Coyote Peterson, has done the bee beard before, but if you check it out, you'll see he's gotten stung a few times. Oh my gosh. I would not like this. I do not like bees. I don't like the sound of them. He may not be allergic to bees, but if he got stung with all of them, you would have such an inflammatory reaction that you do increase the risk of a bad outcome where you could have significant hypotension. You just have so much peripheral swelling that your intravascular space is reduced in volume, so your blood pressure is super low. If somebody is allergic to bees, even just one bad bee sting could actually set off anaphylactic shock, leading to that potential of swelling, hives, nausea, vomiting, difficulty breathing. Some people will describe some shortness of breath or tongue swelling or itching.
These guys are going to get on that centrifuge back there, drink as much milk as they can. We're going to see what happens. This is the Vomitron.
Oh my gosh. I'll never forget, I've gotten vomited on once through an NG tube. After that, my reflex relating to other people vomiting, like the sympathetic vomiting scenario, it's gone. I don't have that anymore. Boring. Oh, all the milk.
I can't drink the milk. I'm going too fast.
Do you worry about aspiration? So if you're vomiting but you're trying to breathe quickly, you might vomit and then inhale your own vomit in. So we see people end up getting either pneumonitis or pneumonia due to that. Oh, barrel jumping on ice. That's pretty impressive. Oh, geez. Oh, ow. I don't know what's more stressful, actually doing these Jackass scenes or being the doctor watching them happen, knowing exactly what could go wrong. That's why I created Chillax by my company Life Happens, designed to support relaxation and to help you stay calm when life gets intense. Check out Chillax at lifehappens.com or on Amazon. Nope. Nope. Ouch. They are definitely wearing a helmet, but their face is exposed. They might fall and hit their head on the side or the back, but if they're landing forward, they can land and hit their nose, their chin, their teeth. If you do lose your tooth, make sure to find it. We can replant it usually within an hour. Just put it in your mouth or a cup of milk. Whoa. You can injure a rib, you can break a rib, even the pelvis here landing on the trash can, compressing it down so much with your full force of your body, you can actually cause fractures or dislocations.
I'm Preston Lacy, here with pro kicker Josh Brown, and this is the field goal.
Oh gosh, he's a pro kicker, so he knows what he's doing. Hopefully he's wearing a mouth guard. I would have worn a full face mask like a football helmet versus just some ski goggles. Getting hit in the face like that with a ball, depending on if it's flat or the pointed end, this can cause serious whiplash injury, head snapping back. You can actually cause a really bad cervical fracture as well as an injury to the spinal cord itself, even if it's just bruising.
You guys look like idiots.
This looks like a racquetball court, and I anticipate the ball just gonna be bouncing around everywhere. I love their outfits. At least they're wearing protection for their heads. Oh, he hit himself. Right in the neck? The biggest thing we worry about, one, you can have a
spasming of your vocal cords,
which basically is the top part of where your airway starts. And if those spasm and lock up, you're not gonna be able to get air through. And because of the trauma of the neck, you can actually cause inflammation, having soft tissue swelling of the airway. Thus, you won't be able to get any air through.
Oh, did you take it in the neck? Yeah. Oh my God.
Oh. Wow. So you can literally break the cartilage of your Adam's apple or anything in your neck. Oh my gosh, this is a bungee of some sort.
Goddamn, this is the BMX tug of war.
Okay. You're wearing a helmet. Oh geez. But why?
Why?
Lands right on cactus plant. Cactus plant has these thorns, and they're just going to cause a significant amount of puncture wounds and injury and discomfort and pain. Increased risk of infection, and trying to get those thorns out, quite painful. Yeah, bad idea. thrown off the couch. You get a pullback of the whiplash going backwards and then lands forward, puts his arms out, but you increase the risk of having a fracture of your wrists or your forearms, and then obviously head injury.
This is the mini loop.
Oh my gosh. Oh geez, get some speed. You gotta get speed. Yeah, you gotta have speed so you can get the centripetal motion, so you can actually have enough gravitational pull to stay on the ramp. So that was a good first fail. Landing on your back, your arm, all these different areas, you increase the risk of having a dislocation as well as fracture. There we go. Go, 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 go. Oh, so close. Lots of fails. Please be careful. Obviously, you're gonna have soft tissue injury, a lot of bruising, a lot of ecchymosis, some contusions, and maybe even a hematoma. You can have a tire burn, which is quite common from the spinning wheel. Oh, this little bike flying around, get you in the face, you know, it can break your jaw, hit you in different areas that you wouldn't expect. So if you fall, just make sure you use your arms in the appropriate way.
I'm Steve-O, and this is the fish hook.
Oh my gosh. At least the fish hook looks like there's no barbs on the one end, so it doesn't get stuck. You can pop it all the way through. But why are you doing this? If it had a barb, we can't go backwards on it. You just snip it on one end or the other and take it out that way. That's gotta be so painful without any anesthesia. Oh my gosh. That is awful and so not smart. Increased risk of infection because of the bacteria that are in our mouth to the cheek. You're gonna have potentially a scar now on your face.
Pretty good.
That hurt to do that to you.
If we ever have to do any type of procedures where we're causing holes, lacerations, anything like that, or cuts, we're using anesthesia. We're giving injections to anesthetize the area. The face has a lot of nerves, a lot of blood vessels. You're doing it blindly, so you just gotta be really careful of what you're actually puncturing.
Now it's time for some man fishing.
That's just awful. Get out of there, man. You can get a shark bite. I know they're rare, but not in this situation where you're teasing them. They always say don't have anything shiny and really no fast motions. And he's got a shiny thing in his mouth coming out and he's like freaking out and flailing. Mousetrap. Oh, man.
Oh, man.
I mean, who had to set all those up? That's what I want to know. Ouch. Hopefully nobody has ever experienced what a mousetrap feels like. It's horrible. It is a nasty spring that can actually break fingers, besides causing obviously soft tissue injury and bruising. Roll quick. But they're not attaching to his skin. I wonder if it actually hurts. I don't want to try though. Oh, okay. You can see that there was a couple stuck on his skin, which actually really hurts. It's like getting pinched by something horrible. Is it something crazy, detrimental, and bad? Probably not, but it's probably quite annoying and uncomfortable.
This is the hockey cup test.
Hockey cup test. I don't know if anybody out there has ever worn a cup before. It's not like this massive cushion to protect your gonads. It's piece of plastic pretty much that just covers the area. You still feel it, you just don't feel it as bad as there was nothing there. Oh my gosh, that's gotta be so painful. It's so dangerous. Hopefully it didn't crack. All I can think about is if the plastic cracks and causes a laceration to the penis or to the scrotum, and then you have a testicle that just comes hanging out. This stuff does happen. Awful. You have your major blood vessels just to either side of your genitals, hitting the artery, hitting the vein, hitting the nerve. You got to be really careful. They all run right together, right next to each side. So that's another increased risk of having a ruptured blood vessel in that area, which can cause even more complications. Oh, geez. Oh, right in the groin.
My groin!
Taking anywhere between a 6 to a 14-pound bowling ball to your groin on the backside. It could hit into the ischial tuberosities, which are the bones that you actually sit on, and you can actually fracture those. You can't actually really get them fixed unless it's totally trashed. You just walk on it because it's actually not a weight-bearing fracture, so it just hurts. Ouch. Sliding headfirst into these pins. You can actually get horrible fractures of your neck. You can have an extension injuries. You can actually cause an injury to the spinal cord itself, where you actually cause a tear, or you actually get blood going down the middle of it, called the syrinx. So a lot of bad things that can happen. Oh, geez. That bowling pin metal crate looking thing can come down and potentially crush you. Also, you guys ever slide bare skin on a gymnasium floor that has that lacquer all over it? It's gonna take some skin off. Awful.
Knoxville knocked my nuts in half.
Oh, it did actually hit his testicles. If the board is too far forward and it looks like the ball maybe bounced up underneath versus does the tissue of your legs and your buttocks stop it before? You never know. It might be hanging really low. That was awful. That was awful. But these, again, Jackass professionals here. They've been doing this for a long time. I do not recommend anybody doing this. If you guys enjoyed this, definitely check out this playlist right here. And as always, make sure you subscribe, turn your bell notifications on, and hit that like button for me. Thank you so much for watching, and stay healthy, my friends.